what are you being told, and what are your plans to follow up?
Well, the thing is, since I came back from India, I haven't even gone to see my family doctor. But she was very supportive when she knew I was going to go to India. And what did she do? She gave me all the paperwork of all the neurologists and all the people that I've seen. Because at the beginning they said, I have fibromyalgia. And I knew it was not fibromyalgia. So they diagnosed me after 10 years of not knowing what it was. And then after 10 years, I went to all the neurologists that you have in Victoria, all of them, and I was not happy. And then I ended going to Stanley Hashimoto, which is an eminence of multiple sclerosis. And then I went there for 15 years, and they put me in interferon beta serum, that is very expensive, by the way. It's $3,000 monthly. And I said, okay, and I did it for 15 years. But then when I arrived in India, I said, no more. And I phoned him, and he said, Sylvia, nobody leaves it cold turkey. I said, nobody, I did. And I did, and I am doing really well. And
but what about your follow-up on your angioplasty, Sylvia?
Oh, I will go next year to India again to see the same doctor.
Okay, and what about you, Betty?
I'm still wrestling with what I'm going to do. I'm not going to go back to Poland. I mean, Euromedics suggests a 6-month follow-up, and I met people that were coming back for their 6 month. They are teaming up with a hospital in New Jersey, so they're going to open a clinic there in the fall. I may go. I'm not sure what I'm going to do. I may end up at, I know Santa Vive, just south of San Diego, has an excellent program down there. I may choose to go there for some kind of follow-up. I'm not sure.
For the study that I was on in Tychy, Poland, it is recommended that you go back for a 6-month checkup. However, they know that the likelihood of that is not very great, considering most people have come from Canada. If I can at all go in 6 months, I will, but time will have to tell.
And BJ, what about you?
Yeah, likewise. I was told when I was in Cabo they'd like to see me in 6 months as well, so I'm contemplating that. Let me see, mid-January? I don't know. Sounds pretty good.
You can take the brunette.
Well, that's why I'm going back. Yeah, I'll be heading back in February, and as a matter of fact, most who can make it from the original 10 are going back in February as well. We're going to make it a get-together as well, but again, it's under the tutelage of Dr. Mogel. We're going to be retested. I guess probably another Doppler ultrasound and an MRV. Just to see whether or not, or what has, if anything, has reoccurred. But still, we are in email contact, especially for updates, and so we're keeping on board with that.
And as for me in Albany, my desire would be to go back to the same clinic and the same doctor. The airport is about a 5-minute taxi ride away from the Albany clinic, so it's something that I could get to quite easily on my own. And I've got lots of air miles from being on Rebiff for 9 years, so I can do that quite easily. But there are clinics opening up closer, and every day it's changing. There are clinics in Seattle opening and all down the western U.S. So, and I know the Albany doctors opened that up to say, look, if you can't come back, call us and we'll refer you to a clinic that's closer and work with their doctors to get you fixed if something happened.
I just got a couple more here, and then I'll come over on that side, okay? So just for you guys here. I got 2 more here, and that's it.
Yeah, I think a final part of the question was, what are going to be our choices here? And I don't think anyone knows that. I've been terribly impressed how fast things have moved forward. This is the power of the internet and Facebook. It has revolutionized the speed with which things have happened, because the paradigm shift really began last September when some of us started to hear about it. I know personally Ashton Embry, who was instrumental in getting the CTV program together and happening. And that was a very big eye-opening piece. We are light years ahead in Canada of the United States of awareness to it. I do a modest number of consultations on the phone to people all across the United States, and most of them have not heard of it at all. All right? So we are blessed to have had two of our major networks have sort of taken on the concept. It's now a challenging decision for the premiers and the health people across the country. I think it's good that it's a challenging decision for them. This afflicts 4 to 1, women to men. It's typically young people. And it's a huge loss of work capability and or taxes, as well as the other downside of which we all know about. So it's time that they really looked hard at it. You could be doing this for the cost of the system within Canada, probably for under $5,000 to the MSP system, when that is a lot less than a year of beta-seron, as we all know, or any of the other drugs, okay? So we need to hope that they're really seriously thinking and talking about it. The energies that you will present and take away from here will have an impact on that. They are going to listen to the people more so than they're going to, weight change within the medical profession. I had a heated argument with a nurse friend of mine who said, Bill, the physicians will sort this out. And I say, no, they will not. There's a whole different set of power challenges happening there, and it's not going to happen quickly. It will happen much, much quicker in the other system. It took us 25 years to show that coronary bypass grafting made any difference to survival at all. 25 years. And we're still uncertain about angioplasty. But that was a group of older, powerful men with chest pain, and we knew that it took away chest pain, period. Well, if you can take away some of the symptoms of MS, even for a time, then I think it's to be out there. And I am very, very tired of being told we only do evidence-based medicine, because the medicine that we practice in regular Western medicine, and I've been part of it for 30-plus years, is less than 20% evidence-based. So it's a saw that I'm uncomfortable with, and I hope that they will really seriously talk about it. I was hugely impressed when the Premier of Saskatchewan moved forward on it. I'm from Saskatchewan originally, and I know some of you are.
Thank you. Hello, Yasmin.
Hi, I'm Yasmin, and having completed 69 cases of MS, the liberation procedure in India since March, I think I have some statistics that all of you would be very interested in hearing. I want to answer this lady's question first because she is about to leave. We've treated people, not me, the doctors in India have treated people ranging from people that have had MS for 30 or more years, all the way to people that have just had it for 2 years, just been diagnosed for 2 years. And there is no difference between the improvement that people with 30 years of MS see and some of the younger ones see. So it does help everybody, and that's what we've seen. So that's to answer your question. And the question about follow-up, I'm really sad to hear that all of you on the panel actually have to go back to Mexico or to the US for follow-up. But the truth is that you can actually do the follow-up here. What we are doing with our 69 patients is we have a weekly follow-up call with them. That's number one. We're recording all the improvements in the symptoms. Number two, they have to have an ultrasound at 3 months and another one at 6 months and an MRI of the brain at 6 months. The reason for that is the 3-month will show if there is any reocclusion, the 6-month the same reason, and the MRI at the 6-month mark is to see if there is any plaque regression. And the whole idea of this treatment was to see if this will stop the progression of the disease, and that's exactly what we're trying to track. In Alberta, there is a clinic in Calgary, Sunridge Diagnostic Center, and Dr. Barry Street is very happy to take on Alberta patients under the Alberta Health Program and do the follow-up ultrasound. So all our patients from Alberta are actually automatically booking for a 3-month and 6-month scan with him, and he's doing an excellent job of it. I thought that BC would be difficult, but just this morning I had a call from my patient in Trail, BC. She went to her GP, he ordered an ultrasound, she went in and she came back, she had a stent actually, came back saying that the blood flow was excellent and she was doing really well. So it is possible, and the technique behind that is that if you're in BC and if you're going for a diagnostic ultrasound for MS, doctors are not allowed to prescribe that for you. But if you have already had a procedure and you're actually going up for a follow-up, it's just like a cardiac stent. Like they can't refuse you. They have to do an ultrasound. So please keep that in
mind. Yeah. Hello, my name's Phil. I have a different sort of a question. It's more for the care partners and caregivers. I assume almost all of you had a partner that went with you overseas. And my question is, in each country, how close do they let the care partner or caregiver to the MRI diagnosis? Can they be present? Or where are you when the venoplasty is done? That's my question.
They wouldn't let my husband in. I wanted him to videotape it, and there were 5 medical staff in the room doing my procedure, and they all wore the big lead aprons, and because of the low-dose x-rays, that was the excuse they gave. Landon, my son, and my girlfriend stayed just outside the door for an hour and 20 minutes. How about you, Bob?
Sorry, I was writing. I'm single. And, of course, being single, I, of course, was in there alone, so that I didn't have to worry about anyone wanting to come and take along with me. So, therefore, they didn't have to worry about that.
All right. Anybody else have an issue with getting people in or out?
Where I was, you weren't allowed in. Well, you can't come in for an MRI usually, but they wouldn't let people in for the procedure either. So
the same. My partner was with me with the Doppler ultrasound, but the actual procedure she wasn't able to come in. But you know they have allowed people in when they've had television cameras there, so it is possible.
All right.
I've heard a question several times about whether or not the stents are MRI compatible. Can anyone answer that question?
Are stents MRI compatible?
My stent is MRI compatible. It's titanium. And my neurologist advised me to find that out before I got it in there. So I think that was very good advice. So it is. I mean, mine is. I don't know about other countries.
Mine is as well. Yep, my stent is the same as Valerie's over here. Titanium.
I had no problem going through the airport on my way back.
My other question is for Betty and Dr. Code. Betty, you mentioned that in Poland, which I'm going to, my appointment is September 21st, that they're doing eye exams, and they did send an email to me and say they do an eye exam. I have listened to people on the net talk about their eyes are clearer after they've had this done. My eyes are so red, I look like a zombie. I'm sure they light up in the dark. They're so bad. And we've done several tests to see if there's anything wrong. Nobody can find anything wrong, so I'm assuming it's related to MS, but this is the first time I've heard of any eye exam being done. Can anybody explain why they're doing it or what appears to be the problem with eyes?
I was told they're doing it as part of their research study, so they're tracking to see what's the level of inflammation in the eyes sort of at the point of treatment and then 6 months later. I just want to let you know that one of the women from Alberta that was treated on the same day I was, one of her symptoms was vision, and she had really, she had a lot of problem with her eyes, and she just emailed me last week to say she's now wearing the glasses that she wore 8 years ago, and she's finding that she's hardly even needing her glasses, so her vision is dramatically improved. But the eye exam took about a half an hour. It was no big deal. And
I'm now reading the white pages in the telephone book without my reading glasses on, and I could barely read them with my reading glasses on before I left.
No, you ask a very good question. It is possible if you're going to improve blood flow, you know, from the upper body, including especially the head and neck, you may notice that change occurring because it's venous backup congestion possibly. But the reason that they like to look at the eyes so much is it's the only nerve or piece of the brain that you can direct